My name is Mary Vincent Mosha. I'm Thrive PhD Fellow. I'm working with Kilimanjaro Christian Medical University College as a lecturer under the Institute of Public Health. I'm a nutritionist by profession. Yeah, I received the funding. It was in end of 2016, so I started in 2017. And my research work is on non-communicable diseases, but specifically I'm working with overweight and obesity in children. Yeah, but now it's not that only obesity in children, but it's double burden of malnutrition, two sides of malnutrition. Previously, in low and middle income countries, for example in Tanzania, we were experiencing a lot of cases of undernutrition, but with change in technology and globalization, urbanization issues, now we have changed. We have double burden of malnutrition. We have overweight and obesity in one side, but at the same time we still face the problems of underweight. And this is mostly accelerated by the change in lifestyle, which affect the dietary patterns and physical activity levels. So increase in overweight and obesity accelerates what we call double burden of malnutrition. For my research, I discovered that overweight and obesity is true really a problem in children, in school-age children, which I researched on. And even just for Kilimanjaro, I found the prevalence was around 15%, which is quite high. So it's not something to ignore. But at the same time, I also observed that children who are thin, so there are two forms of malnutrition occurring in Kilimanjaro. But even other people who has done similar studies in some parts of the country, they observed similar findings. So now it's time to change to change our mentality, because we usually focused on undernutrition only, but now it's time to change to think on the occurring or the fast growing burden of overweight and obesity in children. So not only focusing on the things which can lead to undernutrition, but also trying to look at the society in a broader picture, because we usually say that overweight and obesity is not as a problem for a single child, but there's a lot of other factors which are surrounding the individual child. So we have to make sure that we include all other factors in order to understand this problem in detail. For example, maybe I have to give an example of my study where I used what we call a socio-ecological model of overweight and obesity. So I started different levels of influence which can affect child behavior. For example, I focused on communities like home environment, school environment, and also I focused on neighborhood environment. So not only like factors which affect direct a single child, but trying to understand what's happening maybe in their homes while they're at home, what is happening there, because we all know that children are learning from their parents and they cannot have a control maybe of their diets or of their physical activity behavior. If the parents say you shouldn't go out to play, then they should stay inside. Or if they have a habit of watching television throughout while they are eating, then it has to be a habit. So a child is learning from the environment which is surrounding. There are people who are wondering, why should I focus, for example, on overweight and obesity while they see a lot of children walking around while they are slender or thin. So I was very much interested to learn and understand more why people are thinking like that. But then when I started and visited different schools and places, I saw a lot of new things. I learned a lot and very much interested to know more and to become a competent or an expert in this field of overweight and obesity. And I'm very much interested because now everyone is looking at me when I say, okay, I'm working on nutrition and focusing on children. So I have a lot of conversation with different people. They want to learn, what am I doing concerning nutrition? How do I help these families or children to be healthy? Yeah, and also I had a chance of meeting with a lot of experts from non-communicable disease team in Tanzania, which also they encouraged me to get much involved in the network in order to work together to help people from Tanzania with this non-communicable disease in general, because overweight and obesity is also a chronic disease or a risk factor for many chronic diseases. The activities, apart from the fieldwork which I conducted during my studies, for now, it's not much, because usually we do the community screening within our Institute of Public Health. So we screen different people from communities for chronic diseases. For example, this year we worked with adolescents, where I went there and screened for non-communicable disease risk. But then for the networks, I mean, the one which I was talking about, it was an opportunity for me because I met different people from different fields. For example, physical activity experts, like not really expert, like they are doing a research on that, but they are eager to help people to be active. So there's a lot of organizations, and I met them there, and they were very much interested with my work. And so I'm very much connected with them for now, and we are working together, and maybe we'll work more in future. First of all, I'm proud. Yeah, of course, it's not an easy job. And I remember the time I was thinking of applying to Thrive Fellowship, because I applied for the second time. The first time it didn't go through, those years when Dr. Florida and others got a scholarship. So for the second time, I was successful, and my mom, I remember she was alive by that time. She was very happy for me to get a scholarship, and she was like every time inspiring me and telling me that you have to do it, and I'm sure you'll manage. And she was proud of me. And even my family, my husband, my sister, and my brother, they were very proud of me getting a PhD. So it's a challenging thing, but for me, I feel like it has helped me a lot. Yeah, because I had a good mentorship from the Northern institution and even from here, and I learned a lot. I can say I'm competent. Yeah, for the college, as college, not yet, because I have to finish first in order to get promotion. But I've managed to like create networks, because I'm collaborating with Cornell University. We have a project just outside there. It's called Uzima Project, which is about, it's called Spaces for Nourishment. It's about nutrition and the healing thing, yeah. And also, like last 2 weeks, we started a collaboration with Radboud University from the Netherlands. It's an existing collaboration, but because they were very much interested with nutrition, so they came to see me, and we tried to see how best we can make sure that we make nutrition in a front line here at the hostel and at the college. Because I have to mention my supervisors. Professor Susanna from the London School of Hygiene, she was on me. She has helped me a lot. Yes, of course, sometimes, whenever I wrote something to her, like an advice, she usually replies on time, and always good, like productive points. And even my supervisor here, Professor Sia, also she has been good. Even Professor Heiner Gross from the London School also. They are very much helpful, and they made me to be like the way I am now. Master students sometimes, and undergrad students, but also like with the CPE project, secondary school students. Yeah, so ours was a student-centered project, and it was done in St. Mary Goretti Secondary School, working with a nutrition class. They designed some activities, and we managed to conduct several, but because of the COVID outbreak, some were not possible. So we had a health promotion activity, because their objectives were to train or to teach their younger ones, the primary school children, about healthy eating and physical activity. So we managed to do a health promotion activity with one of the primary schools in Kilimanjaro. And now we developed a comic book in which we are going to launch it today at the school. In the school, of course, you see like students who are very, very happy, and they were eager to learn, because they even asked me questions when I was there about nutrition, sometimes about reproductive health. And we designed several programs, because I remember they wanted to get a to get like a kind of a workshop from the reproductive health unit, but then it wasn't possible because of COVID. So they learned a lot according to them. Yes, and you see they are happy. For example, the time we were doing a comic book, all of them I sent pictures to Dixon, so you can see how were they like interested in that activity. Yeah, yeah. And some were even asking me, okay, to like to inspire them. How comes now you are doing your PhD? Where did you start? Because there were people in their class who were saying like, okay, you are doing nutrition, it might be difficult for you to get a college or maybe to go further. Yeah, I can say like it has been an added advantage because we have been doing the same, like almost the same thing, but trying like to upgrade, because there are times when you just do research, then you don't go back to the community, you don't involve like stakeholders or other community members. So for this one, it has been an opportunity for me to involve, because even parents are aware. The time we were doing activity in in primary schools, even parents were aware what was going on, and we distributed stickers for like a healthy plate model to take them to the parents, for children to take them to the parents or to take them home. So at least you see something is going on, because I was receiving phone calls like, okay, we have seen this kind of health plate model, and even parents were happy, like they were saying our children now are trying to see to watch what they are eating. Yeah, so it's a good thing. And also we had a plan of inviting the time, because today we'll just be launching the book at the school, but we have to involve the school health coordinator from the municipal and the teacher or member of parliament. Also, I'm thinking when we are going to like deliver the book officially to the, like at least it has to be known by the government. I have to say, of course, like my supervisor, Susanna, she was on me most of the time, and she kept me being like active and smart, because whenever you say this, you have to think critically. She's always saying like, you have to think critically, don't just read fast and write. So she kept me on the track.